Hi everybody, welcome to another episode of Body by Ravi Plastic Surgery. Today I want to talk about the ever so awesome plastic surgical procedure known as the Brazilian butt lift. Let me start off by saying that the problem with the Brazilian butt lift is that it shouldn't be called the Brazilian butt lift. We live in Houston. So why is it the Brazilian butt lift? Where did that name come from? Well, obviously a lot of surgeons in Brazil were doing liposuction and transferring that fat to the buttock area to reshape the buttock. And it kind of came out as the fact that this procedure was widespread in Brazil and it became ever more popularized in the United States, and so that name is kind of stuck. The problem with that is that, like I said, we don't live in Brazil, and for the purposes of this video, I'll refer to it as the Brazilian butt lift because that's what the majority of people know it as. That's how it's been marketed, so to speak. But the bottom line is, if you actually break down what Brazilian butt lift is a procedure in which we do liposuction. We take that fat and we inject it into the buttock. What people don't realize is that people always come to the office and they say, "Well, I don't want a huge butt," and I tell them, "Well, you don't have to have a huge butt." What I tell them is that we try to shape the buttock area, and if you actually look at and you study gluteal aesthetics, you realize that a really nice buttock is not necessarily a large buttock. If you just take fat from an area and you take that fat and you inject it into the buttock, but you don't have a really nice shape to your buttock to begin with, all you're going to be left with is a larger buttock that doesn't look good. And so the key to liposuction and fat transfer to the buttock, or buttock shaping as I like to call it, or even call it the Houston buttock lift for all we want to call it, we can call it that. But it's an addition-subtraction game in which we subtract from around the area of the buttock. Specifically, I like to liposuction the upper back, the lower back, and the waist areas, as well as the flanks. And also, I like to liposuction the tummy, because if you make the tummy smaller, you make the upper back and the bra roll area and the lower back and the waist, and you really make it sleek and slender, automatically it makes the buttock look bigger. So 70%, people don't realize this, but 70% of the increase in size of the buttock comes from removing everything around the buttock. Once you remove everything from around the frame, then you can take that fat and you inject it into certain parts of the buttock to help shape the buttock. Sometimes you inject it to increase volume, but sometimes if there's enough volume, sometimes you just inject it to the area around the buttock, like on the outsides of the buttock, to create a nice round shape to it. And that's what is the key to the Brazilian butt lift, or the Houston butt lift, as I like to call it. So the procedure is done under general anesthesia. It takes about 3 to 4 hours to do, depending upon how much liposuction needs to be done. Patients go home the same day. It is not a painful procedure if it's done properly. Most of my patients have very little discomfort associated with it. In the first week or so, there's going to be some discomfort, and everyone's a little bit different in terms of how they perceive the procedure. But it's nothing like a tummy tuck or anything else, which can be have a little bit more discomfort. The important thing about it, and I'll talk to my patients a little bit more at their preoperative visit and in their initial consultation, is how much of the fat stays, and that's always the hot topic. Well, I tell patients about 20 to 30% of the fat that we put into the buttock goes away. At 6 months or 6 weeks after the procedure, half the swelling is gone. 3 months, all the swelling is gone, and by 6 months, you can really look at your buttock in the mirror and you look at your shape, and that is your final shape. So whatever fat has stuck around after 6 months is yours forever, and that's typically the way it works. I tell patients to not exercise any type of heavy intensive exercises that increases metabolic demand for about 2 months, and the reason for that is not so much that there are a lot of incisions and things like that have to heal properly, but as you become more active, if you're using up a lot of calories, there's a possibility for some of that fat to go away. So most of your everyday activities can be done, but don't want you to overdo it in terms of burning too many calories for the first 2 months, or gym activities for 2 months. The second thing is I tell patients to sleep on their tummy or on their sides for 2 months. Obviously, you don't want to put the pressure on the buttock where we've just put all that nice fat, because that pressure will help squeeze some of that fat away and more of that fat will die. I tell patients not to sit at all for the first 10 days. So if you want to watch TV or something like that, it's usually sleeping on your tummy or on your sides. After 10 days, I allow patients to use a pillow or a towel They make certain type of special BBL pillows. Obviously, if you want, you can buy that. Those can be a little expensive, but all you need is a pillow that you roll up, or a towel that you roll up, and you put it right underneath your hamstring, or on the back of your thigh, where the thigh meets the buttock, so that when you sit, you're propped up, and you're not putting pressure on the buttock area. And typically, you're going to be in that position for about 2 months as well. So, and we also have you wear a garment for about 2 months. Just like any procedure, there's always a little bit of bruising and a little bit of swelling. But like I said, it's not a painful procedure. It is a very rewarding procedure. Patients can get significant improvement in their buttock shape and contour associated with this procedure. And I'm actually a proponent of actually doing buttock grafting or buttock shaping at the same time as a tummy tuck, and that's a different video, and we'll get into that. But fat, to me, and most plastic surgeons, I think we all agree that is liquid gold. So instead of just throwing it away after you suck out the fat, many women can benefit from improvement in shape by transferring that fat to the buttock, whether it's done with just liposuction and transferring that fat to the buttock at the time, the so-called BBL, the Brazilian butt lift, or again, as I like to call it, the Houston butt lift, or doing it at the same time as a tummy tuck. Many women who've had children who have those excess stretch marks and the excess skin in their tummy also have a little bit of buttock droop. The buttock has lost a little bit of volume, and it's a little bit loose, and so doing a fat transfer to the buttock at the same time as a tummy tuck can also be performed. But we'll talk about that in another video. So as always, hopefully this was helpful in terms of understanding a little bit more about liposuction and fat transfer to the buttock, again known as the Houston butt lift. Kind of get away from the whole Brazilian butt lift, but it's a little bit hard to, because that's how everybody knows this procedure. So as always, if you have any questions, please call our office or visit my website for some pictures. And if you want, just come in and stop by, and I'll be more than happy to talk to you folks out there who are interested in having this procedure done. It is a very popular procedure. More patients have been coming to my office requesting it. I absolutely love doing it because the results can be extremely dramatic, and patients have extremely high satisfaction with the actual procedure itself. So until next time, thank you very much. Thanks for tuning in, and see you soon.